Hi, this is Wendy, and my group is Wafa, Wendy, and Juliana, and we are talking about symptom management model. This model has been developed by UC San Francisco in 1994, and it was tested by faculty members and students through their research and expanded through their discussions and seminars, and it was last updated in 2001. In this theory, the definition of symptoms is a subjective experience reflecting changes in the biophysical functioning, sensations, or cognitions of the individuals. There are 6 assumptions for this theory. The first one is study of symptoms are based on the person's perceptions of symptoms and their self-report. The second one is the model can be applied to anybody who is experiencing symptoms and also anybody who might be at risk for developing symptoms. Third one is nonverbal patients such as infants, they do experience symptoms and their caregivers and parents are the ones that interpret the symptoms and we assume that the interpretations are correct so nurses can intervene. Fourth, all troublesome symptoms needs to be managed. 5. Management strategy can be targeted at individual, group, work, or family environment. And last, symptoms management is a dynamic process. In this theory, there are 3 concepts: symptoms experience, symptoms management strategy, and the outcomes. Symptoms experience is simultaneous perceptions, evaluations, and response to a change in his own feelings. Symptoms management strategy, effort to avert, delay, or minimize symptoms experience. So we want to make sure we see a reduce the frequency of symptoms, decrease the severity of symptoms, and also relief of distress that is associated with the symptoms. And the outcome of interest is symptoms, and the way we measured it is by frequency, severity, and the distress that might be coming along with the symptoms. Factors that is influencing symptoms management are environment, persons, health and illnesses, frequency of symptoms, and severity of the symptoms. And here is a diagram to show how all the components are related to each other. Person is the variable, the intrinsic to the way that the individuals views and respond to the symptoms experience. Health and illness is the variables include unique to the health or illness state of the individual. And the environment include the physical, cultural, and social variables that represent the aggregate of conditions in which symptoms are occurring. So, physical variables include the person's home, work, or hospital. Social variables include the individual's interpersonal relationships or source of social support, and cultural variables represent values, practice, and beliefs that arise from the individual's racial, ethics, or religious group.
Thank you, Wendy. In our research study example, we chose this study that was conducted to evaluate the effect of a nurse-led symptom management program developed based on the symptom management model on the quality of life and the severity of symptoms in women with gynecological cancer undergoing chemotherapy. This nurse-led management program included regular systemic symptom assessment, prioritization of symptoms, and symptom and patient-specific education on non-pharmacologic evidence-based self-management interventions. Let's start by talking about the significance of this research and a little background to understand how the symptom management model fits as a theoretical framework for this study. Over the last decade, advances in cancer treatment have increased the survival rates, but cancer diagnosis and its treatments lead to many adverse effects impacting the quality of life. Studies show patients affected with gynecologic cancers experience a wide variety of a cluster of symptoms that is dynamic, synergistic, and concurrent. The authors used the symptom management model as a framework to evaluate the effect of the study intervention. Reflecting on the information Wendy presented, implementing the symptom management model in cancer can ensure continuity of nursing care and more effective strategies supported by continuous assessment. We know that each concept of this model is related to the other two concepts, and these relationships occur repetitively or even simultaneously. And these three concepts are embedded in the concept of individual health illnesses and environment, which are the basic concepts of nursing to systematize the conceptual relationships in nursing research. The second concept in the model, which is symptom management, contains the question to guide the clinician or researcher in providing appropriate intervention strategies. The main outcome of interest in this study was the change in symptom status. Other outcomes included functional and emotional status, self care, cost, quality of life, and morbidity and mortality. This study was conducted as a randomized control study. The sample consisted of 41 women diagnosed with gynecologic cancers who received chemotherapy at Koch University Hospital outpatient chemotherapy between November 2018 to December 2019. The nurse-led symptom management program spanned 15 to 16 weeks in-person meeting during a treatment cycle. The authors used three valid and reliable tools to assess and evaluate quality of life, symptom severity, and sexuality. The first one, the Edmonton Symptom Assessment System. The second one, the European Organization for Research and the Treatment of Cancer Quality of Life Questionnaire. The third one, the Brief Sexual Symptom Control Checklist Women, was used to screen for sexual problems. A total of 12 brochures were created, including one with general chemotherapy information and 11 others focusing on specific symptoms like pain, fatigue, and more. Each symptom specific brochure included information on the symptom, possible causes, and evidence based strategies for prevention and management, categorized as recommended for practice. They were used during education in the intervention group and given participants as needed. Brochures were provided based on symptom assessment to avoid overwhelming patients. The symptom management program involved face to face patient education led by the primary investigator. This diagram demonstrates the study design. 46 patients were invited to participate in the study, 5 individuals were excluded. At time 1, all participants underwent an initial interview, received education and brochures on chemotherapy treatment and related symptoms. They also completed the 3 questionnaires using the 3 research instruments for quality of life, symptom status, and sexuality. The participants were randomized into control group and intervention group. At time 2, participants in both groups underwent various interviews during their chemotherapy cycles. Final assessment conducted with time 3 at the last chemotherapy cycle, and this data was used for statistical analysis. According to the study, implementing the nurse-led symptom management program showed that women with gynecological cancer can benefit from the program regarding quality of life, symptom severity, and sexual health status. The nurse-led symptom management program prevented the quality of life deterioration, particularly in functional aspects such as physical, emotional, and cognitive. The nurse-led symptom management program effectively prevented the increase in overall symptom severity, including pain, fatigue, and more. The results of the study indicate that the nurse-led symptom management program had a positive impact on the quality of life, symptom severity, and sexual health of women with gynecological cancer undergoing chemotherapy. The study followed a randomized control design. Randomization helped reduce bias, increasing the accuracy of the result. The study's findings align with the previous research indicating the potential benefit of nurse-led intervention in improving the quality of life. The study employed statistical analysis to determine the significance of the observed differences between the intervention and control group. The study did have limitations such as relatively short follow-up duration, long-term effect of the nurse-led symptom management program were not assessed, and a future study may be needed in this regard. Finally, this research study is a prime example of how symptom management theory, when used as a theoretical framework, can guide research design, data collection, and result interpretation effectively. This application of symptom management theory led to a more effective and relevant approach to symptom management, ultimately benefiting the quality of life and symptom severity of women with gynecological cancer undergoing chemotherapy. Okay, and now I'm going to turn it to Juliana to walk us through the application of the symptom management theory in nursing practice.
So symptom management theory, or SMT, provides a framework to nurses to effectively address and manage symptoms experienced by patients. Nursing practice guided by this theory focus on improving the lead overall quality of patients' care by focusing on physical, psychological, social, and spiritual symptoms. Symptom management theory provides a framework to nurses to effectively address and manage symptoms experienced by patients. Nursing practices guided by this theory focus on improving the overall quality of patient care by focusing on physical, psychological, social, and spiritual symptoms. Literature review and analysis of the American Association of College of Nursing led to the development of programs created so the graduates have the capacity to effectively evaluate patient symptoms and develop and implement effective management strategies to achieve optimal outcomes. Some examples of SMT in nursing include nurses assess patients thoroughly to identify the symptoms they are experiencing. This assessment considers not only physical symptoms, but also the emotional, social, and spiritual aspects of the patient's experiences. It's essential to understand the full scope of symptoms affecting the patient. Based on the assessment, nurses develop individualized care plans that consider the unique needs and experiences of each patient. These care plans are tailored to address specific symptoms and their underlying causes. Nurses work closely with the healthcare team, including physicians, specialists, psychologists, and social workers, to develop a comprehensive approach to symptom management. They also maintain open and empathetic communication with patients to ensure that their needs are understood and addressed. Nursing practices include continuous assessment and reassessments of patients' symptoms and the effectiveness of symptom management strategies. Adjustments are made to care plans as needed, considering changes in the patient's condition and symptoms experiences. An emerging area of research using SMT related to nursing practice is the development of instruments, questionnaires, interview guides, and checklists to help the clinician better characterize a patient's symptom experience. Further research is needed to evaluate these tools for symptoms measurements. A few challenges are mentioned above, which require some further explorations to make it possible for nurses to be able to fulfill the concepts of the theory. Nurses may encounter ethical dilemmas when managing, such as the decision related to pain management, end-of-life care, and advanced directives. Resolving these dilemmas while upholding patient autonomy and ethical standards can be challenging. Addressing these challenges in symptoms management requires ongoing education and training for nurses, effective teamwork, the use of evidence-based practice, and a patient-centered approach that respects individual values and preferences. Additionally, healthcare organizations can support nurses by providing resources, interdisciplinary collaboration opportunities, and supportive work environment. Understanding the cultural belief, practices, and values of diverse patient population is essential for providing cultural competent symptom management. Nurses may face challenges in bridging cultural gaps and ensuring that care is sensitive to patients' cultural backgrounds. Addressing emotional and psychological symptoms can be emotionally taxing for nurses, as they often deal with patients who are in pain, distress, or facing lifetime limiting illnesses. Providing emotional support while maintaining professional boundaries can be challenging. Developing individualized care plans for each patient can be resource-intensive and time-consuming. Nurses may face challenges in tailoring care plans to meet each patient's specific needs and preferences, especially in the high-stress or fast-paced healthcare setting. These are some examples of the way nurses can provide care using this theory. For example, 1, a patient undergoing chemotherapy experiences severe nausea and vomiting. Nurses can use the theory to develop individualized care plans, recommend antiemetics, medications, and provide strategies for managing nausea and vomiting, such as dietary modifications or relaxation techniques. In scenario 2, a patient with chronic back pain is seeking pain relief and improved quality of life. Nurses can employ the theory to assess the patient's pain experience, develop personalized pain management strategies, such as medication, physical therapy, and self-care techniques. and promote the patient's self-efficacy in managing pain. In conclusion, theories can be customized to fit specific clinical or patient care situations. They provide a flexible framework that can be adapted to the unique needs of patient settings. Theories can help nurses address specific healthcare problems and challenges. They offer structural approaches to problem solving and decision making, allowing nurses to develop effective strategies for patient care. Applying these theories can lead to the better patient outcome. By using evidence-based guidelines and principles derived from these theories, nurses can enhance the quality of care they provide, resulting in improved patient satisfaction and health. These theories contribute to the advancements of nursing practice. They encourage nurses to engage in ongoing professional development, research, and innovation, promoting the growth of the nursing profession. Many of these theories emphasize patient-centered care and individualized approaches. This is essential for delivering care that respects patients' values, preferences, and unique needs. And last, you will see our references here. Thank you so much.
Thank you, everyone.